Welcome. As part of the Public Health Dayton and Montgomery County COVID-19 Incident Management Team, I would like to welcome you to today's presentation. In today's presentation, I will provide you with an overview of the current COVID-19 pandemic, including number of cases both globally and here in the United States and Ohio specifically. I'll explain what we do know about the current virus, how it's spread, what the most common symptoms are, how you can prevent the disease and protect yourself, your staff, loved ones, and those around you from contracting COVID, and what we're doing here to continue preparing for the peak in cases and how we continue to respond. I like to start the presentation with this slide. Many of you have likely heard about the movement to flatten the curve. Everything our state continues to implement will result in fewer people being infected at this critical moment in time. What we are doing is preventing a surge in cases, as can be seen with the red curve. If we do not continue to follow the protective measures that have been put in place, we will inundate our healthcare system. Thus, we want to remain part of that blue curve and continue implementing protective measures so that we don't surpass the capacity of our healthcare system. So what is a global pandemic? As you're aware, the World Health Organization officially declared COVID-19 a pandemic on March 11, 2020. A pandemic is merely defined as a health condition that has spread globally. As of March 30th, there were 202 countries, areas, or territories throughout the world with confirmed COVID cases. And just for record, the last pandemic we saw here emerged in the spring of 2009 when a novel influenza virus emerged, and that was H1N1. On this slide, you'll find updated case counts. These numbers were relevant as of March 30th, 2020. As you can see, globally, we've reached over 693,000 cases with over 33,000 deaths. In the United States, we've had over 122,000 cases and over 2,000 deaths, and in Ohio, over 1,600 cases and 29 deaths. If you visit coronavirus.ohio.gov, you'll see some blue boxes at the bottom of the page. One of those blue boxes says COVID-19 Ohio Dashboard. If you click on this, you can then hover over a map of the state of Ohio and find Montgomery County. This map will give you updated case counts with numbers of hospitalizations, individuals in the ICU, and this number is updated daily on this website. So again, these numbers are ever changing, and while these numbers were relevant as of March 30th, they continue to increase. So I would encourage you to find updated case counts for Ohio at that website. If you'd like national numbers, you can visit the CDC's website. On this slide is a heat map of the United States, showing the reported COVID cases throughout the country. As you can see, New York, Michigan, and California are the darkest, with 5,000 or more cases. And again, this was updated as of March 30th, 2020. I've provided you with a situational update, but what I'd like to do now is go into the details of what exactly COVID-19 is. So coronaviruses are a family of viruses that cause diseases in both animals and humans. They often circulate among camels, cats, and bats, and sometimes evolve and infect people, like the MERS and SARS outbreaks in previous years. COVID-19 specifically is part of this family of viruses. This strain was first identified on December 31st, 2019 in Wuhan City, Hubei Province, China. It's a respiratory illness most commonly spread person to person. And the unique piece of COVID, again, is that it is novel, meaning it's new. We have never seen the strain of this virus. Because it is new, what we know about it is ever evolving, and we continue to learn about this disease day after day. On a previous slide, I showed you a heat map of the United States, but I'd like to go a bit more into detail about how exactly COVID-19 is affecting the US. So as I had previously mentioned, the World Health Organization had officially announced this as a pandemic, meaning it's officially spreading worldwide. And in many parts of the world, it's spreading from person to person. The first two cases here in the United States were in California and the second outside of Chicago. The Chicago case was the first person-to-person transmission here in the States. Over the past few weeks, however, New York State's case count has continued to escalate. They're now sitting at over 50,000 confirmed cases to date. And just for perspective, the next highest is California and Michigan, and they're sitting at slightly over 5,000 cases. Currently, the United States COVID cases include those imported cases from travelers, cases among close contacts of an already known or confirmed COVID case, and then community-acquired cases where the source of the infection is unknown, meaning that it's spreading throughout the community. Most United States states are now reporting some community spread of this disease. This is why our stay-at-home order and social distancing precautions are so very important. COVID-19 is mainly spread between people who are in close contact with one another. Many of you have probably heard the 6 feet limit for social distancing. That's because they define that close contact as within 6 feet. It's spread through respiratory droplets that are produced when the infected individual coughs or sneezes. Thus, it is not airborne at this time. What we do know is that it's spread through those respiratory droplets. Those droplets can land in the mouths or noses of those who are nearby and possibly be inhaled into the lungs and potentially infecting another individual. It may be possible that a person can get COVID-19 by touching a surface or an object and then directly touching their mouth, nose, or eyes. However, this is not thought to be the main way the virus spreads. Again, at this time, what we do know is that the virus is mainly spreading from person to person. As you can see in the visual on this slide, it's important to understand the symptoms of COVID-19 and how it's different from the common cold and flu. The main symptoms are still fever, cough, and in more severe cases, shortness of breath. If someone is concerned about their symptoms, we really encourage them to contact their healthcare provider via phone so that they can be evaluated accordingly. On the last slide, I know that I mentioned COVID-19 has some similarities to seasonal flu in terms of symptoms. However, COVID-19 is spreading 2 to 3 times quicker than the seasonal flu. Most who develop the symptoms of COVID, however, won't develop serious symptoms and will recover from it quickly after a few days of rest. Based on the current research that is available, roughly 15 to 20% of those who fall ill with COVID-19 will develop serious symptoms and require higher levels of care. I'm sure you've also heard a lot about the vulnerable, more susceptible populations. Those include elderly and immune-compromised individuals, or those with pre-existing health conditions, which I'll get to a bit more on the next slide. So as I had mentioned on the previous slide, those individuals who are elderly, immune compromised, and with pre-existing conditions are at the highest risk for severe disease. Some examples include those who are over age 60, have cancer, diabetes, heart disease, hypertension, lung disease. They may have another condition that compromises the immune system, or maybe taking medications that suppress the immune system. Again, these buckets of individuals are really those individuals who are more at risk for severe effects of COVID-19. On the previous slides, we've talked about what COVID-19 is, how it's spread, what the symptoms are, and who is most susceptible to this disease. However, the information on this slide is incredibly important, not only for you and your staff, but it's also important items that you should be educating the individuals you're serving on. So first, stay home when you're sick. Second, cover your cough or sneeze appropriately. If you're using a tissue, obviously throw that tissue in the trash immediately. Third, clean and disinfect frequently touched objects and surfaces. I will say that the CDC has some great information available on this. If you Google cleaning and disinfection for community facilities, CDC, you'll find some great guidance for cleaning and disinfecting appropriately. Additionally, the Ohio Department of Health has a checklist for cleaning and disinfecting alternatives for when those everyday supplies run out, which is what many of us are seeing now. And the fourth piece of this is that if you or an individual you're serving feels their symptoms are severe, it's very important that they contact a healthcare provider. Many providers are trying to set up virtual consultations to limit that in-person contact, given the nature of this disease. But again, seek medical attention if the symptoms warrant such. I'd like to briefly speak about why we've seen this increase or really ramp up in efforts by the federal government. Over the past few weeks, as you know, there's been a lot of movement with social distancing and the stay-at-home orders. Other states have put shelter-in-place orders into effect, which is similar to our stay-at-home order. And we've really just kind of ramped up what those restrictions are and really encouraged the social distancing piece. So just for perspective, a few weeks ago, Italy had around 320 cases. As of March 30th, they had over 97,000 cases with over 10,000 deaths. That's a case fatality rate of around 11%. And when you look at the worldwide case fatality rate, we're sitting at around 4.7%. And those both case mortality rates are concerning because they're much higher than our seasonal flu case fatality rate, which is roughly 0.1%. Again, but seeing numbers like Italy's are vastly concerning, hence why the United States is putting all of these precautionary measures in place. It is so very important to prevent the severity of this disease and prevent future death and illness from COVID-19. So again, in the United States, the CDC really continues to closely monitor this COVID-19 pandemic. They are relaying information to state and local partners regularly. Travel has been restricted and government is suspending entry of foreign nationals from parts of the world. Additionally, we've got testing available across the country. However, the testing piece I'd like to talk a little bit about. Not everyone needs to be tested for COVID-19. Most people have mild illness and are able to recover at home. There's also no treatment specifically approved for the virus. So again, that testing isn't going to change the treatment that would be recommended. Testing results, however, would be helpful to inform decision making about who an individual has come in contact with. And the CDC has issued guidance for who should be tested, but ultimately that decision of whether testing is needed will be at the discretion of the individual clinicians and providers who are treating that individual. And additionally, CDC and the Ohio Department of Health continue to create detailed guidance and checklists that are really supporting our community partners throughout this crisis. There's guidance documents for cleaning, social distancing, homeless shelters, social gatherings, religious gatherings. There's guidance for anything and everything at this point in time. So I would really encourage you to visit coronavirus.ohio.gov to find many of those guidance documents and checklists. So I've talked a little bit about what's been done federally and across the United States. Here at the state level, as many of you have seen, Governor DeWine and Ohio Department of Health Director Amy Acton have issued a number of orders that are really supporting that flattening of the curve here in Ohio. Social distancing is a theme through all of this, and it is so very important to continue remembering to do so. If you're an essential business or you have to go to the grocery store, practice good social and obviously physical distancing where possible. But again, all of the orders on these various sectors here on this screen have been put in place as those precautionary measures that are really helping to flatten that curve. And again, you can find all of the orders from the state of Ohio and from the governor and Director Acton on coronavirus.ohio.gov. And towards the bottom, you can find a link that says Public Health Orders. And the language of all of these orders signed by Dr. Acton and/or Governor DeWine can be found there on that page. Public health has been doing a lot, obviously, in terms of preparedness and our response to the current COVID-19 pandemic. The Unified Command is officially operating here in Montgomery County with a number of key partners. At the health department, again, we're continuing to engage in long-term planning and preparedness efforts in collaboration with all of those key county and regional partners. We know, again, unfortunately, that this disease won't go away overnight and that we've got to start planning for those things like a vaccine if and when that's made available later in the year. Again, we have to monitor potential and confirmed cases as the health department, so that is something we are actively doing and will continue to do. We are communicating the most relevant, timely information with the public. So additional information can always be found at our webpage, or you can listen to our daily media briefings following the governors. Additionally, we continue to provide outreach through education, just like this opportunity I've provided for you all. And we also are operating a COVID-19 information phone line. That number is 937 225-6217. And at that number, you can reach public health and nursing staff here at the health department who can provide information on the coronavirus. You can ask some of those frequently asked questions, and we will do our absolute best to respond accordingly. Another important conversation around coronavirus is the personal protective equipment, otherwise known as PPE. As you can see here on this slide, around 90% of our PPE is produced within Asia, and many of these plants have been shut down since mid-January. So at this time, it is so vitally important that we are conserving and preserving PPE at all costs. We cannot waste any of this PPE, and it is, again, so very important that all agencies and partners in this are conserving their PPE as best they can. We do know that surgical masks are sufficient against COVID-19 unless you're doing procedures that aerosolize it. So again, though, PPE conservation of such is so vitally important right now. So as we wrap up this presentation today, I know I've talked about a lot. We've talked about what COVID is, signs, symptoms, what the federal government's doing, what we've done at the state and local level, what you can do as an individual. But I'd really like to reiterate what it is that's your role in this crisis. So there's three areas, right? The first is to stay informed. Make sure you're gathering your information from credible and reliable resources. Some of these would include our public health website. We have a page on there dedicated to COVID information. Visit the Ohio Department of Health site, which I referenced many times throughout this presentation, coronavirus.ohio.gov, or you can also reference the World Health Organization's page. Again, but it's important that when you're staying informed, you're being informed with reliable and credible information. The second piece I would encourage is that you ask questions. It's okay, and it's important to do so. We have that information line that I had referenced to answer those very questions that you all have. And then the third piece of this is to be prepared. So be prepared both as an individual and a provider to community individuals. Ensure that you've put the appropriate supports in place to allow for the appropriate precautions to be followed. And again, so that all of us can contribute to really flattening that curve. And just to reiterate, if you're sick, please stay home. Cover your coughs and sneezes appropriately. Clean and disinfect those frequently touched surfaces, and contact a healthcare provider if your symptoms are severe enough and you feel they warrant that medical attention. With all of that being said, I'd like to thank you all today for joining me for this virtual presentation. Feel free to call our information line at 937-225-6217 if you have additional questions, or feel free to reach out to any contacts you might have in the health department, and we would be more than happy to point you in the right direction. All the best, and stay healthy and safe. Thank you.